Hey everyone, welcome back to the channel. In today's video, I just wanted to talk a little bit about what it was like going through the symptoms I had for my kidney cancer when this all started 2 years ago. I wanted to talk a little bit about getting referred to a urologist and what that experience was like with him. And then at the very end of the video, I'm going to answer, I'm going to provide three different questions that we had for our urologist. They're pretty common questions that you might have for a urologist if you're about to get a nephrectomy done, but it's just something to keep in mind if you're going down that path. And it's by no means an exhaustive list of questions, but it's just something you can add to your arsenal if you need them alongside any other questions you might have for your doctor. So to start us off, I thought I would talk a little bit about the common signs and symptoms of kidney cancer that you should be looking out for. Now, I do want to obviously put a disclaimer out that, even if you have some of these symptoms, it doesn't necessarily mean that you have kidney cancer. Like, it could be anything, and the best thing to do is to obviously reach out to a doctor for their own professional advice rather than, Googling on, WebMD or Mayo Clinic or whatever it is. I highly don't recommend doing that because that'll just kind of get you in your thoughts and drive you a little bit crazy. But if you're doing that for the sake of helping you make an informed decision of whether or not to judge severity and maybe decide to go to the hospital or not, then yeah, it might not be a bad idea to look into it then and see what it has to say online. But I really don't recommend diving into it too much because, trust me, I've done that and it's led to nothing but bad anxiety. So the common signs and symptoms you might face if you are, potentially dealing with kidney cancer is hematuria, which is blood in the urine. You might experience pain in your lower side or your lower back or just the side and abdomen in general. You might notice that there's an actual physical lump or mass that you can feel in the abdomen, side, or back. You may have a lack of appetite lately, which might be leading to unexpected weight loss. Could be due to appetite, might not be due to appetite, but just things to keep an eye out on. And then, if you're feeling, a ton of fatigue or a constant tiredness, even though you might be sleeping well, those also could be signs that you might have kidney cancer. And lastly, but again, not least, because it's not an exhaustive list, there's many different symptoms you'll be facing, but if you're noticing that you're having fever or night sweats, that also could be a potential indicator of kidney cancer. So those are just some common signs and symptoms to look out for. Again, if you have that, it doesn't necessarily mean you have kidney cancer. I just want to preface with that, obviously, right? You shouldn't be just saying oh, I saw this online, so that must mean that I have it. I would highly recommend reaching out to a specialist to see what they have to say about it, but try not to really dive into it too deeply on Google because it's just going to cause nothing but, stress and anxiety for you. So starting off with my experience and what my symptoms were like, this goes all the way back to July 2023, so 2 years ago this month. I came home from work on a Monday, I was having dinner in the evening, and then I noticed out of nowhere I was having a severe amount of pain in my right lower side, and it just came out of nowhere, and I really didn't know why that was happening or what was going on. So I went and laid in bed, I took some acetaminophen and ibuprofen. It did help a little bit, but obviously, it didn't take away the pain completely. I went through the entire week being in complete pain. On Wednesday evening of that week, I spoke to a physician over what's called TELUS Healthcare. For those of you who aren't in Canada, or even for those of you who are in Canada and may not be aware of it, you can actually book doctor's appointments online if you can't see your family doctor or get into a walk-in clinic. So it makes it nice and convenient because obviously, it's nice and easy to talk to a doctor online over a video call. Which is, can be really, really handy because, my family doctor, she's 2 hours away, so it's hard to get in to see her, and the walk-in clinics are usually pretty busy here. So I spoke to the doctor and he said, the symptoms I was having, they were kind of appendicitis-like, but not quite. So he said, maybe you're having what's called a smoldering appendicitis, which is basically just like light symptoms that lead up to the actual symptoms of an appendicitis, because I was having pain in my lower right side. I was having hematuria, which is blood in your urine, and I couldn't explain any of it or understand why any of it was happening. But obviously, and he said to me, without being able to see me physically in person, it's really hard to make like an accurate assessment of what might be going on. So he said to me, like, listen, like, keep an eye on it. Like, if it gets even worse, go to emergency, don't hesitate. But, it could be something called smoldering appendicitis. So that's kind of what I ended off with him. I just thought, maybe I'm slowly getting an appendicitis and that's where this is leading, because the rest of the week, I had pain, I had blood in my urine, and then Friday, because I was feeling guilty about not going into work, I went into work in the morning, and my bosses, and my coworkers looked at me and said, hey, like, just go home. Like, you don't look well, and like, you should be resting and recovering, and not being here right now. So I will say, my work has been nothing but amazing, throughout this entire process over the past 2 years. They've been extremely supportive and nothing but helpful. So thank you so much to them, especially if you're watching, you know who you are. Thank you so much. It's really made a difference in my life, not having to, worry about work too much. So by Friday, after I had gone into work and I went home for the rest of the day, I decided, what, if this isn't feeling better or doing better by tomorrow morning, which is Saturday morning, then I would go to the emergency room. So waited out that night, was still taking my pain meds, and then woke up Saturday morning. What do you know? The pain and the hematuria is gone. So it's like, where did that come from? What was that? And then I was thinking, like, maybe it was just a smoldering appendicitis, and maybe that's what I have to expect in the next little bit of time. Like, maybe an appendicitis is going to come on full force. So I didn't really pay too much attention to it. I just kind of, it was done. So that's what it was. And I kind of went on with the rest of my life. I will say, like, obviously, hindsight's 2020. Like, in retrospect, I wish I just went to the hospital at that point, because I could have caught everything, obviously several months earlier, and, maybe it would have been a better case at that point. I will say, it's not that I didn't go out of stubbornness. It's just, with the current state of healthcare in Ontario, it's hard. Like, I know the doctors and the nurses, they're just absolutely like slammed at the hospitals right now. They're so busy, and I just felt bad because I didn't want them to feel like I'm wasting their time or there for a stupid reason, Like, we have two friends, they work at the hospital here in Kingston, or at least one of the hospitals, and they said, like, don't worry about that. The fact that you're even worrying about that obviously already goes a long way, but I said, like, just go if I need to go. So, I mean, I didn't end up going, right? But I wish I had of, and I would highly recommend, if you're having any of these kinds of symptoms, go see your doctor or go to the emergency room immediately, because obviously it could be a sign of something more nefarious. So after all this, it took a bit of time for symptoms and signs to resurface again. So this all started in July 2023. Fast forward to the very beginning of October, and things started kind of popping up again. So at the beginning of October, I went to Mississauga, which is right outside of Toronto. I went there for a work trip, and the very first evening that I was there, I started noticing my hematuria, the blood in my urine again. So this time, though, the amount in my urine was a lot heavier than it had been in the summer. So a little concerning, but I wasn't super worried about it because, I've had, the hematuria before and it didn't really amount to anything. So I was like, you know what? I'll just keep an eye on it. If it gets worse throughout the night, then I'll go to emergency tomorrow if I need to. So I went to bed and woke up for a normal, pee in the middle of the night. It was 4 a.m, and the blood was even worse than it was earlier in the night, and it was like nothing like what I've had previously. It was very, very bad. So I had to wake up my coworker Ryan. Ryan, if you're watching this, thank you so much again. You know how much I appreciate you taking me. But I had to get him to take me to the hospital because obviously something wasn't right, and it was time to finally go and get checked. Like, there's no point putting this off anymore. Like, I need to find out what's happening. So while I was at the hospital, I did a blood test, a urine test, and an ultrasound. The CT scan machine at the hospital, I believe, was down at the time, and I'm not really sure why they didn't send me for an MRI, but those are what they did. The ultrasounds found the masses on my right kidney, one of them being very, very large, and so the doctor there wanted to refer me to urology in Mississauga, but obviously that wasn't going to work because I don't live in Mississauga and it's 3.5 hours away from home. So, I thought, like, I asked them, can you refer me to a urologist in Kingston? And to my surprise, they said no, they wouldn't do it. They said they can't do it outside of, like, I guess their area, which doesn't really make sense to me because I'm pretty sure, like, the healthcare system in Ontario, like, the systems are linked for, like, patient files, I'm pretty sure. So I'm not really sure why they couldn't just refer me to a urologist, but that's fine. It is what it is. So after them telling me I had these masses on my kidney and that I need to see urology, I went immediately home that same day. And then the next day, I went to a walk-in clinic because the doctor said I had to go to either a walk-in clinic or emergency room to get a referral to a urologist in Kingston. So when I got to the walk-in clinic, I had to wait for quite a bit of time because it was pretty busy. I think I was there for 45 minutes, and then I started experiencing the worst pain I've ever felt in my entire life. Uh-oh! I know I kind of mentioned this in the first video, but I don't even know how to describe it. It was just the worst pain I've ever felt, and it kept getting worse and worse, and I had to actually leave the walk-in clinic because I needed to go to the hospital because of how bad I was feeling. Funnily enough, the hospital is only like 2 blocks away from the walk-in clinic, but because of how much pain I was feeling, I couldn't walk there. So I had to get an Uber there. And then once I was there, I tried to kind of fast track myself with the triage nurse and see if I can get in quickly because obviously I was feeling completely horrible. So I went up to the nurse and asked her, like, is there any way I can, like, be seen, ahead of people because I feel horrible. And she said, like, I'm really sorry, but, like, there is a long line ahead of you. And, she didn't say this, but I'm not an important person, right? Like, I'm not more important than anybody else there. So it was just like, I had to go sit down, kind of wait a bit more. But eventually the pain got so bad that I had to, like, run outside and go throw up. The security officer at the front door was nice enough to go let the triage nurse know, and then she came out and got me and immediately triaged me, which was really nice of her. I'm really thankful that she did that because, like, I needed something immediately to help with the pain. So she brought me back to a room and she got me started on morphine to help cut the pain, which it really did help. Obviously, it didn't take it away completely, but it helped a ton. So while I was at this hospital now in Kingston, I did similar tests to what I did in Mississauga. So I had to do a blood test again, a urine test again, but this time I was able to do a CT scan. And the CT scan confirms what was found on the ultrasound that was done in Mississauga. So Megan and I, we were waiting for the doctor to kind of come and discuss the results of the CT scan with us at the hospital. And he came in and he said, hey, listen, like, based off of what this is looking like, it's probable that it is cancer, but they were going to refer me to a urologist at the hospital there so that I could talk with them about it and see what the next steps are. So the good thing was that obviously I got done what I needed to get done that day. I got that referral to a urologist at home, but obviously the news wasn't really what we were hoping for. At the time, it wasn't guaranteed that it was cancer, but, the doctor was saying it probably is. So not really what we wanted to hear. So the doctor ended up scheduling an appointment with our urologist the week after. So I was at the hospital on Thursday, and then he scheduled the appointment for the next, I think it was Monday or Tuesday, and they sent me home with some morphine to kind of deal with the pain and until we saw the urologist the following week. So obviously, Megan and I were both nervous about going into that appointment because we weren't sure what to expect, right? Like, there was Obviously, a lot of stress and anxiety around the facts that we were just told that this is probably cancer. We didn't want to have to wait to find out, what the next steps were, what it meant, kind of thing, what treatment were we maybe going to be going through. It was just a very, very stressful time, but it was only a few days wait. And then once we got there, we were very, very happy and impressed with the urologist we were set up with. He was super, super kind. He had our best interests at heart, and he was very, very helpful, very, very kind. So, I thank him so much because he made that transition from like going in from, what was kind of normalcy in my life to really crappy time. Like he really helped ease us as much as possible into that situation. In our first conversation with him, he said to us, like, listen, I've seen hundreds of these cases, and there is a 95% chance that it's cancer. And due to how my right kidney was working at the time, he said the entire kidney needed to be removed because it wasn't functioning properly. It was kind of cool, actually. He showed us what like my kidneys looks like on the CT scan. He showed me like what a healthy one looks like, my left one, and then showed me what my right one looks like. And the difference was, I can't really explain it through words. It's just something you kind of have to see, but the difference was pretty astounding. So he scheduled the surgery for us a month from that appointment we were at to have the entire kidney removed. Obviously, we were scared and anxious for that surgery, and we, didn't really know kind of what to make of everything because it was so fast and it was hard to process everything. I highly recommend, if you ever have to go to these appointments, don't go alone. Bring a family member, your partner, a friend if possible, because I will say, like, at least for me, in the movies when people have like that really high pitched ringing and like voices get tuned out and like it seems like the person's completely spaced out. That's kind of what happened to me in that appointment and a lot of the other appointments I had after that. I didn't get like that high pitched ringing noise, but it's like you can't take anything in. It's like you don't hear anything, like you're just in shock. And, you're not really retaining anything the doctor's saying. So it really helps to have somebody there with you to take notes, ask questions on your behalf, because there's a very good chance you're not going to be able to do it for yourself. So he sent us home with the surgery dates, and, we obviously went home. We were anxious. The waiting game is honestly the worst. I will say that. Talking to other people who've had, cancer, and also seeing on subreddits for kidney cancer and cancer in general, like waiting is oftentimes the hardest part of everything because, it's so anxiety inducing. You have no idea what's going on. Like I was nervous that are things getting worse in my body? Is the cancer spreading? I wanted to know what's like the results of the biopsy were, but we wouldn't find that out for like a month and a half because the surgery is a month away, and then the biopsy results would come in 2 weeks after the surgery. And I was just wondering like how we even got into this situation, and like wondering, like how are we going to deal with all this? I'm not like super young by any means. Like I am 35, so that's relatively young. I know people all the time younger than me get cancer, so it's not like the rarest thing that I have cancer at my age, but I was 33 at the time. Like you don't feel like you should have cancer at that age. And like, other than the cancer, like I am extremely healthy. So it didn't really make sense to me that I was having, these things happen to me. So trust me when I say I know that like waiting is the hardest part of everything. Like I know how anxiety inducing it can be, but if you have somebody to kind of, help you get through it, talk things out with you, that's the best thing. It's also try to go into these appointments with your doctors with as many questions as possible, because the more obviously, the better you're going to feel about things, even if maybe you won't get the answer to everything. But, for us, we felt like we had everything we needed answered. It was just waiting for a month, not knowing if things are getting worse in my body and having to worry about that surgery, because I was scared of having to do that surgery. I was, it doesn't feel good when you're about to lose like a vital organ. Like there's a reason we have 2 kidneys, and it felt weird that I was about to have mine taken out. You know what it's like when you're a child and like you've done something wrong and you're in trouble. Like that's how I was feeling. Like I know I didn't do anything wrong. I wasn't guilty of anything, but like it just felt like everything was wrong, and I felt like there was something like in my chest, and like things just didn't feel right or normal, because they weren't right or normal, right? And like that's just how it is when you hear this news. But it's okay to feel that way, and if you are feeling that way and you're feeling lost, trust me, I know how that is, and it's completely normal. There's no normal way to approach these things, and no normal way or set rules to deal with these things. You deal with it the best you can, and if the best you can is what you're doing now, then keep going that way, because that's obviously what works for you. So to end this off here, I just kind of wanted to talk about those 3 questions that were important for us that we had for the urologist, kind of ending our appointment with him and going into the surgery. So the first question we had was, what is life going to look like living with one kidney? And and to our surprise, our urologist told us that you can actually live a very long, healthy life with one kidney. He said my left kidney was actually working overtime because my other kidney was, failing. But you could live a very healthy life, and just because you have the two doesn't mean you necessarily need to have the one to live a healthy life. So that obviously felt reassuring when I had to have it taken out. The other question we had was, how much experience does he have, completing those surgeries, and how many times has he seen patients like this? And he's done it hundreds of times. So we were confident in our urologist to do that surgery for us, because he's done it countless times. And those friends we have at the hospital, they actually mentioned that they knew him and how good of a doctor he was. So obviously that made us feel really good. And the last question we kind of had was, like, what things can we do and can't do, essentially, and like what was like the expected recovery time? Because we're like, at least at the time, we are very, very busy people. We have things going on all the time. The recovery period after the surgery was 8 weeks, but it potentially could have been longer depending on how it went. But like he told us to lay low for the most part, and I couldn't really do a ton following the surgery. So it was disappointing, because obviously you lose out on some of those things you like to do in life. And I had to, it took me a long time before I could like walk normally again. So yeah, these are just some of like the important questions you should be bringing up with your doctor. Again, this is not by any means an exhaustive list. You might have other questions that make sense for your case. I recommend, Googling common questions to ask for things like this. Because it's always, you want to be as armed as possible going into these situations, to make yourself feel better, and also to make sure you're fully educated in the situation and you can make the best informed decisions for yourself. That's all I kind of had for today for the video. So I hope that was informative and educational, kind of hearing about, what it was like for me in the beginning and leading up to the diagnosis. I will say, like obviously it was a very, very stressful time in our lives. Not that it's not stressful now, but honestly, the initial shock of everything and kind of going through that and being super anxious about it and the waiting period, that was extremely, extremely hard. But we're all in it together, and I'm here for you if you need me. And if you have any questions, please let me know in the comments. I'm more than happy to answer them. If there's anything specifically you want to hear in the next video or see, let me know, and I'm more than happy to kind of get to them in the future. As always, if you've liked today's video and you're not subscribed yet, make sure you hit the subscribe button, turn the notifications on, and leave a like on the video. I'd really, really appreciate it. That's all I have for today, guys. Really hope you enjoyed it, and I'll see you guys next time. Thanks.